So my name is Lauren Raff. I'm one of the assistant professors in the Division of Trauma and Acute Care Surgery. I'm currently medical director of the step-down unit and also the associate trauma medical director. A general surgeon is a type of surgeon that does a lot of different things. For example, I do elective surgery where people come in from home and have a problem that needs to be fixed, for example, a hernia or a sick gallbladder. Also, I take care of patients who come in through the emergency department with more critical surgical issues, and I take care of patients who have suffered severe trauma because of a car accident or a gunshot wound or things of that nature. And then lastly, not all general surgeons do this, but the kind of surgeon that I am does critical care as well, where we take care of patients in the surgical ICU. First and foremost, my philosophy is to provide excellent patient care at all times. I've had experience with having to go through, an unexpected medical problem and have had to have emergency surgery myself, and I remember feeling helpless and terrified, and so I think that perspective, I try to integrate that into what I do and integrate that into my interactions with the patients that I take care of, and really just try to be there for them emotionally. And I think it's important for patients to know that I will really just go above and beyond to take care of them through every part of the process to the best of my abilities. And really, I just strive to treat people like I would hope that my family members would be treated. And I also think it's important that they know that I just really understand all of the emotions that go along with having to have surgery, especially when having to have surgery unexpectedly or when you get sick unexpectedly. I know that that's stressful and scary, and I just want my patients to know that I will be here for them and I will support them in every way that I can throughout the entire process of getting them better. Part of surgical critical care that I and several of my partners here at UNC do is something called ECMO, which is a procedure that essentially involves putting patients on a bypass machine when their lungs are really sick. Due to the recent COVID pandemic, as you can imagine, we've had to do ECMO a lot for patients, and it's been really amazing seeing the number of patients that we've been able to help with doing ECMO, young patients in particular, some of whom who have gotten incredibly sick from COVID and despite being on a ventilator remained really critically ill. And we've been able to save quite a lot of people from dying from COVID. Part of why I enjoy doing what I do is because it's really remarkable to take somebody who is quite sick and near death in a lot of instances, and with either a surgery or critical care management or something like ECMO, we are able to really help rescue people and give them back a life that is worth living.